Everyone is vulnerable to being pinned when life plays hardball, whether it is a physical or mental health condition. No one can stand alone. For those who are not pinned, appreciate that it could be you or loved one someday. So when you see a chance to help someone, please do. They are not weak, they are pinned. Even a slight hand up and a listening ear can begin seriously lightening the load, change, or save a life. Help end stigma. Move from being pinned to purpose. Time for a hand up.
Hello, everyone. It's Jeff Moore, the founder of the Pin to Purpose podcast. It's a great pleasure for me today to introduce our guest, Tom Rasto, who is the founder and director of programs, partnerships, and resources at Mental Health and Wellness Kenya. And Mental Health and Wellness Kenya focuses on a healthy mind is a healthy life. And so, Tom, we have just met, but I've been reading about the amazing work of your organization and want to congratulate you from the very beginning. I think we're going to have a very interesting conversation on this podcast, and I'm sure that it's going to be helpful to some people learning about your organization who will want to connect with you, not just in Kenya, but around the world, to compare different programs and ways that your work can be helpful with their work and individuals as well in terms of their mental health journeys. Just as a reminder for viewers, Pin to Purpose is an initiative that I started, having had a lived experience and wanting to contribute to eliminating stigma and also to bring forward people who can help them with a hand up on their healing journeys. There's a metaphor on our site about every single person in the world. We're all human. We're all vulnerable to, depending on what happens in our lives, to have mental health challenges and mental health conditions. And so based on that common humanity, these dialogues are about promoting eliminating stigma and giving a hand up on healing journeys. So enough on my side. Tom, I'd like to hand it over to you if you'd like to say a few words to introduce yourself and your work, and then we'll talk about more specific things.
Okay, thank you so much, Jeff, and for this opportunity to be at this particular podcast. And I love the title in itself, Pinned to Purpose. It means you're not just directing your energy elsewhere, you're pinned that energy to purpose. So my name is Tom Rasto. I'm the co-founder and director of programs, partnership, and resource mobilization at Mental Health and Wellness Kenya. We are based in Nairobi, Kenya, the Kenyan capital, and today I'm ready to discuss about the issues at hand and sharing my perspective from Kenya, the African perspective of how we are fighting stigma and the efforts that we are putting in place to highlight various issues and the challenges that we are facing as a country in regard to addressing cases of mental health and depression. Thank you so much. I'm ready to engage today.
Great. Thank you very much, Tom. So, Tom, maybe you can start off just by saying, why did these issues interest you, and then why did you found this organization?
First of all, I'm a person with lived experience, having been born in a background where we have regard to absolute poverty. The poverty index in where I come from is kind of high, and so getting basic necessities, you get to a level that you're traumatized because of how the conditions that you're born in. And so stigmatization is very key. We could say, like, right now, where I come from, you can be so poor to a level that you can never be invited in any session because they think you have nothing to contribute to the person. So that is one thing that I said I have to change the narrative. I have to change how things are viewed here. So how do I do that if I'm not in a position to be stable mentally? So these are the platforms that we lacked while growing up. And even right now, it's still a problem getting a platform where you can highlight key components of mental health or talk about issues that are affecting you as a person. So that is the brainchild behind coming up with Mental Health and Wellness Kenya, so that even as we converse, we need to provide this platform to other people to also get a chance to speak out. So that is why we founded Mental Health and Wellness Kenya while in campus in 2018. We had nothing, we had an idea, but an idea is important as the people who are pushing that idea. So we had to come out with a group of young students together, and we founded this as a CBO, community-based organization, that was to help the community within the university framework to at least highlight and share about the issues that they are facing. That is how Mental Health and Wellness Kenya came to being.
That's great. Can you tell me a bit about how it all started off then? So once you had the idea, you wanted to bring it to action, and you needed to start gathering others interested in resources. And I imagine possibly fight stigma for your organization as well, from people who were skeptical or had those preconceptions. So I'm wondering if you can talk a little bit about the beginnings once you got the organization started.
Actually, about that is the fact that when things were coming into birth, we were still in campus, we were young, and we were naive at some point. We were like, sometimes they say that birds of the same feathers flock together. So when I share my story with you and share the story with the other people, we get to a level where now we can discuss, you see, and talk about these issues in real time. So by just uniting to that level is what made us to make sure that we can discuss and talk about it. We can call other people who have similar issues. And when they listen to a story, they tell me, "Hey, man, also have the same. I've faced the same while growing up." So it's kind of difficult on my end. So from there, we discuss together and know what things are facing us. By then, we got to ourselves that, oh, so we are that many. So some people are suffering in silence and they cannot come out and speak about them. That's how we got a group of people to discuss the same. So that is where we found Ebenezer Chengo and one of my colleagues, Salim and another. You see, that's how we came to supporting each other and provided a platform. It was before that it was just a platform for us to come and talk about it. But later on, we now got to a level now because we are not judging each other. That's how we came and found out that actually it's important to discuss issues, and through that we got together and we went and did the registration because we had to operate formally. We went and did the registration. That's how Mental Health and Wellness Kenya came into being.
Great. Now,
But
can you tell
us students who don't know each other, you don't know where you come from, I don't even know your home, but finally we were united by a purpose.
Yes.
And that's why I like your podcast being pinned to purpose. So we were pinned together to purpose and do something for the community.
That's great. No, well, maybe we can touch on that concept of purpose, because for me, the thinking that people who are pinned, who are really weighed down by mental health challenges or conditions, one of the key things to aspire to, obviously, is to look beyond their situation, to focus back on a goal or a purpose, and again, get beyond themselves, to get them involved in community, in connection, in broader things like you're talking about with your organization. So maybe you can talk a bit about some of the programs that your organization is leading now and how that all ties into helping people out and engaging them. I'm sorry, I'm not sure if you're hearing me now or if
I can hear you.
Okay.
And, what I'm saying is that as an organization, we have several programs and we are anchored on 4 pillars. The first pillar of it is we have a program called My Story, Story Yangu. This is what we began with before even we identified that we can do anything. Ours was based purely on story, a purposeful approach to storytelling as a way of fighting stigma. So, with that, my story yangu is a program. My story is English, and then story yangu is Swahili, which is our native language here in Kenya. So that story is a platform for us to come out and share about the predicament that we are facing as young people, the predicament that the community is facing in general, because it is a platform for everyone to come out and share. So we get to understand your perspective, how you have been fighting your inner battles, how you have been fighting the cause alongside other people and supporting communities in regard to providing a platform for them to share without fear of being judged or anything. So that is what my story yangu basically entails, and we have been doing it basically on X Spaces, and so that I cannot be able to see you, I don't know you, so but I can listen to you, of course. And then after that, we got to Adatam, and we got to now TikTok. We had to decide to do TikTok so that people also share. And also, we graduated. As a good student, you have to graduate always. So we had to now do it physically. People coming out just like TED Talks. Yeah? People coming out and sharing their stories, and we getting to understand their perspective, and also bringing on specialists, that is therapists and counselors, to discuss and the findings and how the learnings from the story. So, with the of course with the person consenting to them discussing this story after that. And but we always do it, no cameras, no nothing, just listen, get inspired, move. That is what the basis of my story yangu. Then we also have Gumzo Afya. That's the Gumzo Afya is this community health conversation. You know, this Gumzo Afya is a Swahili. Gumzo means conversation. Afya means health. Conversation surrounding health. This one now is a bit general because we also take the trauma and stigma surrounding reproductive health in women and girls in the community. So this Gumzo Afya is what is getting out the community to come out and speak. They say, oh, it's not me facing these problems alone. There are other people facing this. So the community also has to get this message. But because my story yangu mainly is about virtual, and most of our rural communities cannot access that, that's how it came into being that we have to do it towards the community by making it as a community awareness program. That is Gumzo Afya. And we also have another program that we have is Afya Elimu mental health space, for high schools. You know, we are targeting basically high school students because when they get to campus and they don't have this knowledge about what is happening in regard to their mental health, it becomes so difficult to control them on this side. That's why we had to come with a program that really creates those youth villages, those high school villages where young students can take charge of their mental health, form peer support and counseling groups to help address their issues as they grow up, so that when they get to campus, they're already aware of what they're going to face. They are already aware of what they're expecting to see. So that is how things are running out, and those are the programs that we have. And we also soon to launch another program called Rauka Africa Leadership. Rauka means Arise Africa Leadership Training, so that as much as we are addressing the issue of mental health, we're also addressing the issue of leadership. You know, it's been an issue, and as you know, governance is the biggest contributor of mental illness and mental health related issues that we are facing. So if the government is part of the biggest contributor, then that basically means one thing, that we need to change the dynamic of how things are being addressed in the community. So we need to also invest in leadership so that people get to understand leadership and also how governance works. And this one will basically shape it in regard to policy.
You've got an enormous amount of things going on, and it sounds like it's having a huge impact. How are you finding the success of these programs, and also the increasing interest? Because it sounds like every one of them, again, is just very well thought out and has the potential to help so many more people.
basically what we're having is that we're trying to bring in like-minded individuals who are ready to volunteer, because mostly we work on volunteering. So when we work on that, we bring like-minded people, we talk, we converse with them, and make them understand what kind of programs you're running and how it will going to affect the community, not even if it's not now, but in future. So they're joining us, and that's how successful it comes out to be. Sometimes it's the only thing that hinders most of us is limited resources to run this program successfully. But with the small impacts that we cause in the community is what is going to require other people to come and join us and also volunteer. When we train you, of course, we do trainings, and when we train you on that training, you go also. We train you not as an individual or just a mental health advocate, but we train you as a TOT, so that a train on trainee, so that you can go also and get an opportunity or rather platform to train other people. So that is basically where we are focusing our energies mostly in, because we understand we have limited resources, and with that we have to maximize on the potential that we have, make sure we get maximum impact in the community. So that is it.
And are you feeling, how long has your organization existed now?
We have been existing since 2018. We'll be marking 8 years this year in November.
That's great. That's great.
Yeah, because it's 8 years since I was in third year in college.
And how do you feel about stigma in terms of over those 8 years? Is there more openness? Is there more understanding? Is there more, is stigma lessening?
Basically the stigma as a mental health practitioner, the stigma that comes on is people fearing that they are going to be seen as weak, you see, when they come out and speak. But now, how are we providing these safe spaces for people to converse? Sometimes people fear even your own peer or the person that you're closer to does not understand you. We feel that we are not being understood at some point. But when we provide these safe spaces, we are looking at a position where we are going to be understood, we are not going to be judged, we are going to be supported, and that's what our focus is. We're going to connect that connection of vigor and vulnerability, that we have to understand we are vulnerable and anything can happen to anyone. Just like in previous conversations we talked about, even a 30-pound the strongest man can be injured by a 30-pound thing, a 30-pound weight or anything. So I'm looking at a position where, as an organization, men have to come out with, and we have to make them feel vulnerable. Yes, you also subject to this. This can happen to any other person, and that's how it has really made very many, especially boys, because most of them are suffering in silence because of relationships issues, because of responsibility issues, but they're not able to speak because there's no one who is going to understand them. When they go back home, they get their wives, and maybe they are very stubborn. They are feeling like this person is not working hard enough to make sure that we get something. But now, when we make them vulnerable, we say sometimes you get it, sometimes you lack. It's God who provides at the end of the day, and it's through also our hard work, the hard work that we put in place. So if that is the case, that basically means one thing: we are going to support you to understand your perspective, to understand the level at which you are needed. We have to get you to know that there's a difference between friends and people you know. And people you know, they're not necessarily your friends. So you don't just go out and share, because some people are there to injure you even more.
Yes.
So, like someone said, there is an issue of you cannot you cannot bleed near a shark, because a shark always follows the blood stains that are moving. So when you try to make sure that don't get injured where there are sharks, there are friends who are literally sharks, and they are ready to listen to you and destroy you even much. They are here ready to kick you. They're just waiting for an opportune time to do that. So they have to, and we also try to teach them to understand that there is a difference between a friend and a person you know. So, and a person you know not necessarily does not necessarily mean that this is your friend. So that's how the spaces that we provide are streamlined to make sure that you don't use your phone while we're having this session. You leave your phone outside so that we discuss a raw conversation. The only thing that you come out with is that what you have consumed in your heart. So you're not able to broadcast without consent of other people, because most people fear sharing because they feel this person will record me and send this information outside there. My family will see me as a weak person. They're not seeing me as a person of impact. That's what we are doing. And that's how it has been so impactful to get people to understand how things are running.
These are hugely important points, and it makes me think of a lot of things, and it reminds me of similar stories in different parts of the world. But as you say, the goal here and with my own Pin to Purpose initiative is to help to lessen the weight on people and allow them to make sure they can share their stories, just as your organization is encouraging people to do in safe spaces. And to certain people, they don't have to broadcast it to the world. They don't have to tell anyone in particular, but they need to be able to share with some trusted people and get some support. Exactly. So I'd like to talk about the bench press theme, though, because when we spoke the other day, I was very excited to learn about your organization. And also I continue to believe that this bench press idea is just one way to universally explain that people aren't weak, but they're in a weakened state. So if you do bench press just the lightest bar, just 45 pounds, and the exercise here is, it only counts if you do it until you can no longer lift it off your chest. So it's the same thing as a marathoner. Like, if they stop right before the finish line and leave or something, it's not over. That's that they didn't complete it. So doing that, the strongest men in the world, the strongest women in the world, everyone in every country, every single time, have the exact same result every time. The straw does break the camel's back eventually. And so it just shows that it's not a matter about weakness. It's a matter about being in a weakened state, because the burdens, the challenges, the weight of somebody's situation becomes that much more heavy when they're dealing with a serious mental health challenge or a mental health condition. And obviously it becomes worse because the more you're dealing with things and you don't have the support to lift it as a spot or to just put it up, that will pin anyone. Every single person in the world has a breaking point. So that's the simple but universally true example. And I try to do that, in workshops where you do have the bench press, let people try it. Very strong people realize that they eventually will get pinned too. And yes, they can recover, but if nobody helps them, then you do it again and you'll get pinned even more. So it's one way, but I think it works. And it's one way to contribute towards, this is not about weakness. This is about people dealing with heavy issues as a challenge or as a condition, and deserving the support that everyone would be happy that they get if it was a physical issue. So I just wanted to sorry, I'm talking a bit long there, but I wanted to get any more thoughts you have on that, because one of the things you're trying to do obviously is to eliminate stigma. And I believe that this is one angle to add to that conversation.
One thing about what I learned from you and the previous conversation is that vulnerability encourages vulnerability. And we have to redefine, for men, especially for men, we have to redefine ourselves and what being a man is. And also, I try to encourage that culture of compassion, because we don't have that culture of compassion. The connection and the vigor of vulnerability should be seen as a strength, but not as a weakness. Because most men see being vulnerable as a weakness, but in real sense, being vulnerable is a strength, because it helps you air out what you're feeling. It gets out. It helps you get over some things that you are facing as a person. So when you're vulnerable and you come out strongly and share about how vulnerable you've been, it helps or encourages another person who is also vulnerable to say, oh, so I can come and share this, and no one will else, and these people are ready to help and support me at any point. So that's what we are. That's the culture that we are encouraging to help eliminate stigma.
Yeah, no, that's fantastic. So I'd like to speak a bit about your organization's goals and the types of partnerships you might be looking for. I just want to mention as well, and we spoke about this. So I was recently invited to be a volunteer ambassador for the Real Mental Health Foundation. I have a lot of respect for what they're doing. They're trying to get 1,000 volunteers around the world. They now have 200 or so in 30 countries on 6 continents. And it is about connection, and it is about um, trying to promote the well-being of in this case men, and supported by women who are very involved in this organization as well. And but it's connecting people around the world to be more open, to talk, to connect. And they're also helping to um, encourage the flow of investment capital on a very large scale, in the billions of dollars, to different companies and initiatives over the coming years. So in terms of your organization and partnerships, I don't know if you'd like to speak a little bit about any of the existing ones, or what you'd be looking for, because hopefully some people who see this podcast, may be able to reach out to you and have some discussions.
Actually, this, this is the position right now. Our organization, as I told you about the foundation story of it, it was formed by a group of students who were still students then. As right now we are out, we are trying to support each other to make sure that this organization plans and supports other people to come out and speak and share the initiative. So our main goal was to, first of all, because we cannot do referrals and we don't have enough human resource, because most young people or most people who come on board, most of them will not volunteer. You see, most of them want, especially therapists. We have to make these services as much available and affordable as possible. So our goal is to have our own wellness center, mental health and wellness center, so that as much as it will generate revenue for the support of other programs that will come on board, it will also provide a platform for people to come out and also seek support. Because basically, as I told you earlier, my country, Kenya, invests only 0.7% of the national budget to mental health. You see, so it means that our own government is also, it's something that they need also to have a conversation on, because we have only one mental health bill that was passed, and it's not even taken so much seriously. And the government has not taken any command or lead to discuss issues of mental health, even within the leadership team. So getting it to understand is that we also need to have, we are trying to fundraise. Actually, we have an active fundraising page that we had launched 3 weeks ago, and we have not yet put it so public, but we are trying to put it public. We are trying to raise resources to set up a wellness center. Even if we rent a place and set up a wellness center, it will be good. But we are looking forward to it, because someone donated land to us, and we are trying to find resources to construct a wellness center, just a simple one for the beginning, so that people might have a place to come. And also that one will also serve as offices instead of renting offices, which we also have as part of our counseling centers. We have 2 rooms within the office that are set aside for counseling. So when we have a wellness center, it will be in a position for us to at least provide these services in a manner that we are not going to be stressed. Because most of how this organization basically runs is, we contribute money amongst ourselves, the founding members. And so, like the basic minimum salary that we are getting, maximum salary that we are getting for all of us that we are within the organization is about 50,000 Kenyan shillings, which is basically about $500, 500 US dollars. So that is what we use. We cut half of that salary to invest in the organization, so that we also get an opportunity to support others. And then half is what we use to maintain ourselves, including coming to the office every day and also doing outreach programs. So we get to a level that it becomes kind of hectic, but we can't shut the dream because we don't have finances, because we believe in people. We believe in investing in people. And that's why we have invested mostly in volunteers. We have almost 180 volunteers, and sometimes when they go out for outreach programs, we have to facilitate at least fair. So we are looking forward. If someone could be willing at some point, and maybe the kind of partnership that we want is, we are very open and transparent in our dealings, and we get a van that will be helping to navigate through regions so that we, instead of inviting these people, we can go to where they are and bring these services closer to the people. Something like a van can be very helpful for us and in regard to navigating. But the biggest thing that we're doing a wellness center. I think if you will allow me, I'll share with you the fundraising link that we're having.
Yep, I can put it on the YouTube channel as well, so it'll be permanently there. People, when they watch this podcast later on, can see the link and can go to it. That's fine.
Yeah. So that's what we are doing, and also in regard to partnership, what we're looking for is we're looking for institutions elsewhere that are having the same, because we need to get the perspective of how Canada is doing it. We need to get how other countries are doing it, the US, the Ghana, South Africa, any other country elsewhere, how they are doing it in regard to fighting stigma. Then we do an exchange program with them. Some of them come here and see how we are doing it and see the challenge that we are facing while in our field of work and service, and also learn from that. Also, some of us can get an opportunity to see how other people are doing it elsewhere and how the challenges they are facing, because challenges are everywhere, as I understand that. You know that when they are in maybe in Europe and you think there are no challenges, maybe in the American side and you see there are no challenges. No, challenges are everywhere, and people are facing challenges in different capacities.
Yes.
So
right.
Our partnerships will, we are looking forward to partners who will first of all come in and support us in the implementation of some of our programs, because not necessarily resources, but even in sharing what they are doing elsewhere can be very helpful to us. That is in regard to exchange programs. So if any other person is willing to have such or either a mental health institution in there that can really take in and give us an opportunity to have an exchange program with them, it will be very many, or a university mental health club that can make an organization so that we can also visit and know how they are doing it there. It can be very instrumental to empower our programs in the universities around Kenya. We should also have campus representatives from each university. At least we have 50 from 50 universities around Kenya, so that we're having these peer conversations, taking part in all those universities. So that's the kind of engagement that we're looking forward to have.
That's wonderful. No, so I will definitely share that and encourage people watching this podcast, if they are interested, to reach out to you. So Tom, I wanted to know, as we move towards wrapping up, if there are any other topics or points or any questions that you'd like to ask and discuss together before we wrap it up. But I think we've covered a lot of ground. As I said, I was really very happy to learn of the great work of your organization, and congratulate you and all your colleagues, as well as the 180 plus volunteers who are directed through purpose, obviously, in the mission of your organization and helping out people. So is there anything else that you'd like to share with our viewers now, or anything else you'd like to discuss before we wrap it up? Or
I just want to discuss a few areas. One of them is about coping mechanisms and escaping mechanisms. Most of what most of us do in mental health, we venture mostly in escape mechanisms. We don't take on coping mechanisms. So as an enemy, we have to look at the psychological well-being and social well-being, which mostly we confuse psychological well-being and social well-being. When the moment you see someone having withdrawal symptoms, we see that as a psychological issue, but basically that's a social well-being. So you see, it's not only a state of you have to understand that mental health is not only a state of mental health, mental illness or absence of mental illness. It's also a state of positive well-being. That is what mental health is. So coping mechanisms can basically be that issue of self-realization, getting to understand that and developing ways of dealing with issues that you're having as a person. So you see, like sometimes you get to a point where someone has maybe is undergoing some duress or stress rather, yeah? They'll resort to alcohol. We are not saying that alcohol is that bad, but the thing is, they now start abusing alcohol as a way of escaping their issues, but in real sense, these issues still continue being with them. So I don't think like it's something that we are fixing. Is that basically there is that issue of fear of the unknown. So people are just fearing for things they don't know about. Instead of trying to fight the battle that they have at the moment, they are fearing the unknown issues that are facing them. So we have to have that cognitive restructure process to help us navigate through our mental health. So how can we do that? We are looking at raising awareness. We have to raise awareness to mental health and tell people it's okay not to be okay. We have to tell people that so when you share, you unleash some burdens out of your life, and that is what is very important. So people also have to redefine as a man who are very people, especially men who are not ready to share mostly, like they have to come out and speak. They have to redefine. We have, as a society, we also have to redefine a man. We have to take a man that a man can also be vulnerable. We don't need to put men in line most of the time because men have always put themselves in line at the last line of defense. That any other person is protected, but the man now has no one to protect them. The current society inclination has gone to the level of women empowerment and now forgetting that also men are becoming more vulnerable even as we empower women. We have to empower society. We don't need to empower women alone. We have to also look at the mental health of a man who is taking charge in doing that. So that is what the community loves. And we also have to look at all the marginalized groups, the small and minority groups. There's no one who is speaking for them. We have to speak for them. Most of our population is in Kenya and like just any other part of the world, the youthful generation. The agitation that they are facing right now is basically you might see as a political, it's a political instability, but they are causing instability. But actually, that's an escape mechanism. You have seen what has been happening in my country recently. If you've seen and if you can go online and see, there's been agitation due to unemployment. There's agitation due to bad leadership. There's agitation due to, and this is affecting these young people mentally. So they are the people who are going out on the streets to demonstrate. So we have to look at it in a way that we are facing it as a way of, they are using that as a way of getting rid of what is the things that are facing them. But we have to develop mechanisms. We have to put policies in place to support mental health initiatives. Even as the real Mental Health Foundation is doing it, I'm very happy for them because at least they are making men come out and speak, and we've seen even women joining the rest to support men to come out and share. You know, that is what we are looking at. So, as an organization, we're very glad that people are coming out across the world to speak about what they're facing, which is very, very important and essential for us. And we feel some burden out of us has been unleashed because there are some people who are coming out to offer us a shoulder to lean on. So big up and thank you for being a good ambassador for the Real Mental Health Foundation.
Fantastic, Tom. Well, thanks so much for your time today and sharing all the details about your fantastic work and your organization. Again, I hope this will be helpful in connecting to lots of people to hear your story and to have more people in Kenya continue to participate and then more broadly to look at partnerships. So I look forward to keeping in touch, and I'm very happy we could chat today. So thanks so much, Tom.
I'm very much humbled and very much grateful for your time and giving me an opportunity to for people across the world to hear what I'm going to say and what from the Kenyan perspective and understanding of mental health. I'm very happy.
Great. Thanks, Tom. Take care.